Welcome back to Meds Made Easy. My name is Tarun. Today we're going to be talking about Dorzolamide and Timolol Eyedrops. They're used for intraocular pressure. So if you have increased IOP, intraocular pressure, usually for people who have glaucoma, right? So if you've kind of failed on therapies like latanoprost, or you didn't get the reduction you were looking for using things like latanoprost, and you move on to a medication like this is a little bit more higher powered. It's got two different medications in there, and so those together kind of have a synergistic effect that provide better reduction in that eye pressure. Let's see, you generally take it by putting one drop in both eyes twice a day. Let's see here, so Dorzolamide, the first thing that we'll talk about, it inhibits the carbonic anhydrase. Now what does that exactly mean? It just decreases the aqueous humor, the eye, I'm going to try to go with as much layman terms here as possible. You have a pressure due to a liquid that's in your eye called aqueous humor. This decreases the aqueous humor secretion, which then in turn decreases the IOP, the intraocular pressure. Timolol blocks the beta-1, beta-2 receptors, and that reduces aqueous production. So it just decreases the production of that liquid that's in your eye. And then so if you decrease the production, obviously you can't have too much. And because of that, you get a decrease in your pressure. So let's go through pretty easy stuff. If you're taking other eye drops, make sure you space them out about 5 minutes. You want to let everything get absorbed in your eyes before you move on to the next set of eye drops. If you're using like allergy eye drops, lubricant eye drops, et cetera, et cetera. For people who use contacts, take your contacts out, put your drops in, and then wait 15 minutes to let it fully absorb into the eye before you put your contacts back in. If you put your contacts back in beforehand, earlier than that, or if you put the drops on top of your eye, on top of your contacts are like sponges. They're just going to soak up the medicine, and none of it's going to get into your eye. So we don't want that. And then over time, that drug will degrade, and if it's in your contact, you can actually cause huge issues. So make sure you stick to the rules when it comes to contacts and medications. Pregnancy class C, so you can take this medication if you need to. Lactation, I couldn't really find any good, for my ladies out there that are breastfeeding, I couldn't really find any information on whether this is safe or not. Again, you get very little systemic absorption, but either way, when you're dealing with pregnancy and children, you always want to talk it through with your doctor to make sure it's safe or not. Renal and liver issues, for people who have renal and liver issues, you generally don't see this having an issue because again, you don't get a lot of systemic absorption, meaning it doesn't really get in your bloodstream too much. Depending on how much you're taking and how long you're taking it for, obviously talk about it with your doctor. If you've been taking it chronically, maybe you're getting a little bit going through in your body, and that could affect both the liver and the renal side of everything, but usually you don't really see that issue. I'm going to put up a list of side effects here. The main things you're going to watch out for are things like blurred vision. If you get that, call your doctor immediately. Burning, stinging, itching, and that's due to the fact that you're putting a foreign agent into your eyes. So kind of the usual stuff. I've never really seen anybody have an issue with this medication. And otherwise it's pretty easy to take. The Dorzolamide has an onset of action that's 8 to 12 hours. The Timolol, I believe, is 24 hours. So it's a long-acting medication, very effective in it all. Not the most cheapest, but if latanoprost, which is Zalatan, if that one's not the most, that hasn't been working for you, then you generally switch over to this one, and this one generally does the trick. So guys, any questions, concerns, leave them down below. We'll answer them, and give us a subscribe to the channel, and we'll see you next time on Meds Made Easy.